Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Menopause. Introduction. Menopause marks the time when a woman stops having a monthly menstrual period. All women go through menopause, usually between the ages of 40 and 55. During menopause, women go through physical and mental changes. Understanding these changes helps you know what to expect and how to cope with the changes. This program explains menopause as the levels of hormones change in a woman's body. Anatomy. The female reproductive organs include the ovaries, fallopian tubes, uterus, cervix, vagina. The female reproductive organs are located in the pelvis, between the urinary bladder and the rectum. The ovaries are glands with two main functions. 1. The production of specialized hormones, such as estrogen and progesterone. 2. Ovulation, which is the release of eggs needed for reproduction. Estrogen and progesterone prepare the inner lining of the uterus in case a pregnancy takes place. These hormones also regulate when eggs are released. When an egg is released, it goes down the fallopian tube and into the uterus, where it may or may not be fertilized by a sperm. If fertilized, the egg becomes implanted in the uterus, where the fetus grows. If not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body through the cervix and the vagina during the menstrual period. The menstrual cycle is usually 28 days. The levels of estrogen and progesterone increase before and after ovulation. If the egg is not fertilized, hormone levels decrease and menstruation begins. Estrogen and progesterone are only two of the many hormones that control the menstrual cycle. In addition to regulating the menstrual cycle, estrogen keeps bones healthy. It may also affect cholesterol levels, keep skin and arteries more elastic, and help memory. Menopause. Menopause causes periods to become irregular and eventually stop. Menopause happens when the ovaries quit making hormones and releasing eggs. When a woman is in her mid-30s, her ovaries begin to change the amount of estrogen and progesterone they make. It is rare for a woman to have menopause before the age of 40, but it can happen anytime between the ages of 30 to mid-50s or later. Smokers often begin menopause earlier than non-smokers do. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Estrogen and life stages. In terms of menstrual periods and estrogen levels, women pass through 5 stages throughout life. 1. Pre-puberty. 2. Puberty. 3. Perimenopause. 4. Menopause. 5. Postmenopause. Pre-puberty. During this stage, a girl does not have periods because her ovaries are not releasing eggs yet. She also does not have breasts or rounded hips and thighs. Puberty. At puberty, a young girl begins to have a monthly period. This usually happens around 12 years of age. The body makes more estrogen, which causes breasts, pubic and axillary hair, and rounded contours of hips and thighs. With puberty, a woman enters the reproductive stage of her life. This stage lasts from 20 to 40 years. During this stage, a woman can become pregnant if the egg is fertilized after ovulation. Perimenopause. Perimenopause is the stage before the last menstrual period. This stage starts 3 to 5 years before the last menstrual period and ends about a year after the final period. Some signs or symptoms of menopause may appear during perimenopause. A woman can become pregnant during perimenopause. Even if periods are irregular during perimenopause, it is best to take precautions if pregnancy is unwanted. Menopause. The event that marks menopause is your final menstrual period. You will know for sure that you have experienced menopause when you have not had a period for 1 year. For a few years, the decreased level of estrogen causes body changes and signs such as hot flashes. These signs are discussed in more detail later. Postmenopause. Postmenopause, the last stage, is after menopause. During this stage, the signs of menopause diminish and go away. During postmenopause, a woman does not have menstrual periods and cannot get pregnant, but there is greater risk for some health problems during postmenopause. The average lifespan of the American female is 78 years. The average age for menopause is 50. This means the postmenopause stage is about as long as the reproductive stage for American females. Signs and symptoms. Changing levels of estrogen and progesterone can cause a variety of symptoms. You may have little or no trouble with hot flashes or other signs of menopause. Some women have slight discomfort. Common signs of menopause include irregular periods, hot flashes, vaginal and bladder problems. Other signs of menopause include fatigue and sleep problems, mood changes, body changes. Coping. The following section discusses the signs of menopause and what you can do to cope with them. Irregular periods. One of the first signs of menopause is a change in your periods. They may become less regular or light. Periods of heavy bleeding are normal too. Heavy bleeding for many days, periods less than 3 weeks apart, periods that last longer than 10 days, or spotting between periods may also happen. Check with your healthcare provider if you find any of these signs troublesome. Hot flashes. A hot flash or flush is common in perimenopause. About 80% of American women have them. Hot flashes can cause sensations of heat, flushed neck and face, red blotches on the chest, back, and arm, heavy sweating, cold shivers. Hot flashes can be as mild as a light blush or severe enough to wake you from a sound sleep. Most flashes last 30 seconds to 5 minutes. They should disappear within a few years after menopause. Here are some tips that help you to keep cool when a hot flash starts. Go somewhere that is cool. Remove a layer of clothing. It is best to dress in layers that you can take off if you get warm. Drink cold water or juice. Use a portable fan. Here are some tips that may keep hot flashes from waking you up during the night. Sleep in a cool, well-ventilated room. Wear light-colored clothing made of natural fibers. Use sheets and clothing that let your skin breathe. Try keeping a diary of when hot flashes happen and what may start them. This can help you figure out what to avoid. Sex. Around the time of menopause, your feelings about sex might change. You may have trouble becoming sexually aroused because of hormone changes, discomfort due to changes in the vagina, or medications you are taking. On the other hand, you might feel freer and sexier after menopause, relieved that pregnancy is no longer a worry. Remember that after menopause, you can still get sexually transmitted diseases such as HIV or AIDS. Until you have gone 1 year without a period, you should continue to use birth control if you do not want to become pregnant. Fatigue and sleep problems. Feeling tired is a common symptom of menopause. You might have trouble getting to sleep, waking up early, or getting back to sleep after waking up in the middle of the night. Night sweats or the need to go to the bathroom may wake you up. If you have not slept well at night, try taking a nap during the day. Mood changes. Some people think that women are more moody, irritable, or depressed during menopause. There could be a connection between changes in your estrogen level and your emotions. Other causes for mood swings might be stress or family changes, such as children leaving home. Exercise helps to reduce stress. Avoiding or reducing caffeine may also reduce stress and sleep problems. Changes in your body. Visible changes with menopause may include weight gain in the waist area, loss of muscle mass and increase of fatty tissue, thinning and loss of stretchiness in the skin, reduction in breast size. Other possible body changes include headaches, memory problems, and joint and muscle stiffness or pain. Postmenopause. 1 year after menopause, hot flashes and night sweats may stop, but reduced estrogen levels may cause other long-term effects on your body in organs such as the bones, heart, vagina, bladder, skin. Bones. Menopause can weaken your bones, a condition called osteoporosis. Reduced estrogen surrounding menopause means that bone strength could be lost even faster. Osteoporosis can lead to fractures of the hip, wrists, vertebrae, sacrum, and other bones of the body. Getting plenty of calcium and vitamin D before and after menopause can lower the risk of osteoporosis. Milk and dairy products, such as cheese and butter, are a good source of calcium and vitamin D. Exercise may also keep muscles and bones strong and reduce the chance of falling and breaking bones. 30 minutes of weight-bearing exercises like walking, jogging, or weightlifting 3 days a week or more is best. Your healthcare provider may recommend hormone therapy with estrogen and often progestin. Other medications may also be used to prevent bone loss. Discuss the benefits and risks with your provider. Heart disease. As estrogen levels go down during menopause, older women may tend to have higher cholesterol levels. High cholesterol increases the chance of heart disease, stroke, and other diseases that affect the heart and blood vessels. After menopause, a woman's risk of heart disease rises greatly. In fact, heart disease kills more women than lung or breast cancer. The following tips will help you keep your chance of heart disease down. Eat a healthy diet. Do not smoke. Maintain a healthy weight. Exercise regularly. The combination of estrogen and progestin may increase your risk of heart attacks, strokes, and blood clots in the legs and lungs. The vagina. Body tissue in the genital area becomes dry and thin as estrogen levels change. Sexual intercourse might become painful because of this dryness. You may be more likely to have vaginal infections. To ease vaginal discomfort during sexual intercourse, use a water-based lubricant such as KY jelly. Do not use petroleum jelly. Other creams and medications are also available to alleviate this problem. The bladder. As you get older, you may begin to have urinary tract problems, such as incontinence. Urge incontinence is when you have trouble holding urine when you feel the need to go to the bathroom. Stress incontinence is when you have trouble holding urine when you sneeze, cough, laugh, run, or step down. If you have incontinence problems, you should talk to your healthcare provider about it. Hair and skin. The skin may become dry and more wrinkled due to menopause. The hair may become thinner. Facial hair may also grow on the upper lip or chin. Unwanted hairs can be removed by a variety of methods. Using sunscreen and not smoking can help to reduce wrinkles. Cancer. Different types of cancers are more common after menopause. The earlier a cancer is found, the easier it is to treat and sometimes even cure. Schedule regular diagnostic exams at your healthcare facility. Contact your healthcare provider right away if you notice spotting, a lump in your breast, or a sense of fullness or bloating in your abdomen. Remember to get a regular pap smear test, mammogram, and pelvic and breast examination as often as your healthcare provider recommends. These tests help to detect cancers in their early stages. Hormone supplements. Estrogen supplements. In perimenopause, your healthcare provider might suggest birth control pills. These can prevent pregnancy, make your periods more regular, and lower your chance of cancer of the uterus and ovaries. Birth control may also reduce symptoms like hot flashes. Birth control pills mask the arrival of menopause. When you might have reached menopause, your healthcare provider may recommend you stop taking the pill for several months to see if you have a regular period. Phytoestrogens. Phytoestrogens are estrogen-like materials found in cereals, vegetables, beans, and some herbs. They may work in the body like a weak form of estrogen. Some may lower cholesterol levels. The effectiveness of these natural estrogens has not been proven. Some plant estrogens are now being studied. Soy, wild yams, and herbs such as black cohosh, dong quai, and valerian root may relieve the symptoms of menopause, but studies have not proven their effectiveness and safety. Check with your healthcare provider before taking any supplement or changing your diet. If you decide to eat a lot more foods with phytoestrogens, be sure to tell your healthcare provider. Any food or over-the-counter product that you use for its drug-like effects could interact with other prescribed drugs or cause an overdose. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Menopause causes periods to become irregular and eventually stop. Menopause happens when the ovaries quit making hormones and releasing eggs. When a woman is in her mid-30s, her ovaries begin to change the amount of estrogen and progesterone they make. Changing levels of estrogen and progesterone can cause a variety of symptoms. You may have little or no trouble with hot flashes or other signs of menopause. Some women have slight discomfort. The decision about how to handle menopause and hormone replacement therapy are best made by talking with your healthcare provider. Any decision you make is not final. You can and should review it with your healthcare provider every year during your annual checkup. Thanks to advances in medicine and public health, women live twice as long as they did 1,000 years ago. More than 1/3 of this time is after menopause. It is therefore seen by more and more women as a time to take pride in achievements and discover a new zest for life. Thank you for using Explain.